Hey everybody, welcome to the Huddle. This is episode 2, and today we're going to talk about taking a pandemic and making computer-based clinicals come to life, or how to take lemons and make lemonade. So I'm joined today again by Kumar. Welcome, Kumar. How are you today?
Hey Cheryl, I'm great. How are you?
Good, good. Okay, so it's time for us to huddle up and share our experiences as a former student, faculty, and now Shadow Health nurse educators to help you navigate this new world of virtual simulation. So, if you're a Shadow Health super user or brand new to the world of virtual simulation with Shadow Health, this huddle is for you. So again, we're going to talk about how do we take these pandemic situation we're in and make some these clinicals come to life. All right, so Kumar, what's going on? Why are we talking about this today?
Cheryl, this all started about late February 2020. We were faced with a big change in nursing education with this rapid infection rate for COVID-19 in the United States. One of the unexpected and unfortunate consequences is that our clinical partners had to restrict student nurse access to patient care areas in the hospital, in clinics, public health departments. And so we quickly found ourselves as educators without a place for our students to go to do clinicals. Could you tell us a little bit about this background?
Yeah, sure. So simulation, as you know, has been rising in usage. And for the undergraduate world, we can think about the National Council of State Board of Nursing National Simulation Study that was published in 2014. And if you recall, that study demonstrated that up to 50% of traditional clinical practice hours could be replaced with a high quality simulation. Now, what's really great is we need to make sure that these simulations follow best practices as set forth from the NACSL standards of best practice. But when we think about what makes up a high quality simulation, we start talking about things like fidelity and the parts of the simulation, the pre-briefing, the debriefing. And so with virtual simulation, we do consider Shadow Health as a high fidelity simulation. It's very realistic. You get to actually ask questions to the patient. Our students have to formulate their own questions. And so it's really realistic and has a lot of interactivity. So yeah, that's the state of simulation and kind of the background that's going on with it. Go ahead.
That's amazing.
Yeah.
Um, do we have any guidelines or any protocols for adopting simulation for this clinical hour replacement?
Yeah, that's a great question. So yeah, every state has the ability through their Board of Nursing to set up their own regulations based on the NCSBN study. Now, they will provide, NCSBN has a checklist and has regulations that they have provided for states as guidance. However, every state has, the Board of Nursing has made a determination of how they want to adopt that. So we have some states that have really not made any designation in their rules and regulations, and some states have adopted up to the 50% simulation replacement. So it's really up to a state by state.
So I heard for those faculty that are, and thanks for that information. I heard that faculty that are using simulation that haven't used it before. I know for our different professional bodies and professional societies, is there one for simulation?
Yeah, that's a great question. There's actually a couple for simulation. So there is NACSL, which is the International Nursing Association of Clinical Simulation and Learning, and also the Society for Simulation in Healthcare, which covers all of healthcare simulation, not just nursing. And these two bodies actually on March 31st of 2020 released a position statement supporting the use of virtual simulation as a solution to our current problem in the pandemic. So it's really strong language from those two organizations to come together and provide that guidance for programs and for states.
That's great. That's wonderful. So there's
Yeah,
actually a place where faculty can go, a
yeah.
professional organization.
Yeah.
that's where they can go. Um, can you tell me a little bit about when we talk about simulation? Can you talk a little bit about fidelity in simulation?
Yeah, no, that's a great question. Yeah, so fidelity, so that's when we talk about the degree to which a simulation replicates a real event. So this will include things like the physical surroundings, the psychological surroundings that they have, and the environmental. So the situation that we put the students in. And so what's really cool is, if you've seen any of our simulations, we put the students right into that room where it happens. We put them in either in a clinic room or a hospital room or an emergency department triage or a school clinic, depending on the patient case. And so we work really hard to make sure that those environments look like what the actual environments look like. And then also we provide for that psychological safety in the simulation, which adds to the fidelity by providing that pre-briefing to set the scenario up so the learners are aware of, what's going to take place and how to interact. We also are going to provide social context for a lot of our social disparities that we talk about in our simulations. So we provide a little bit of a snapshot into what to consider for the cases that they'll be working through.
That's amazing.
Yeah,
It sounds like you've got the whole clinical reasoning and high fidelity components built into these programs.
yeah, yeah. It's really a neat way to simulate an experience for the learners, whether they're in graduate or undergraduate.
So I'm starting to understand now that some of our clinical hours could be simulation, and we've got some high fidelity options for simulation.
Yep, that's right. Yeah, yeah, it's definitely a great option for providing high fidelity simulation to replicate what the students are unfortunately not able to do right now since we have the pandemic. What's really great though is we do provide that clinical reasoning piece in the simulation. And so if you think about clinical reasoning in nursing, especially, is that process of the collecting of data and cues and then kind of processing that information to determine what's going on, figuring out what they need to do for the patient and carrying it out, and then evaluating how the outcomes were for the patient. Did they, are they improved? Do we need to make a change to the plan? And so we're able to go through that with the learners as well, so we can replicate what they're seeing in clinicals so that when they do get back into clinicals, they'll be prepared for those situations.
Do you foresee simulation in this way being something that we only do during COVID-19, or is this something that we can integrate into curriculum going forward?
Yeah, Kumar, that's a fantastic question. So we're really seeing a push right now because of the situation with the pandemic and, with students not being able to go into clinical sites, faculty needed to find a solution and find a way to get some experiences for the learners. However, we were widely used prior to this, and as a way to supplement the clinical experiences that the learners have, this is a great way to do it with our virtual cases. We are going to be able to provide learners with some of those experiences that they may not see in the hospital. They're all standardized, so you know exactly what the outcomes are supposed to be from the patients. You know what the students are supposed to be learning from each one of them. We also have a mapping available to any accrediting bodies so that you don't have to do that work as a faculty member. We've done that for you.
That's that's pretty amazing. That's
Yeah,
really great to hear.
yeah.
This is just kind of a whole new world for educators to be in. So I know it's very stressful for a lot of faculty out there and a lot of students.
Yep, it is. It is. But we're here to help you. Just remember, this is a whole new world. We've been there before. We both were faculty prior to coming to Shadow Health. And so we know what it's like to have to integrate a virtual case into your program and successfully do that. So I just want to take this time then to say thank you to everyone for attending and spending time with us today. And just remember, if you like this episode, don't forget to like the video and subscribe to the channel by selecting subscribe below so you can stay up to date with our episodes. So until our next huddle, take care of each other. Bye.
Bye bye.